Hello, world. Welcome to episode 5, depending on how you count, of Take 3 and Call Me in the Morning. I am joined by the lovely Pega. We are flying solo today, missing our best man Vahid. But we're going to start introducing everybody to the world of stress and its role in our physiology and our daily function. But first, per Vahid, I must read our glorious podcast disclaimer. So, the information provided in this podcast is for educational and informational purposes only and is not intended as medical advice. Listening to this podcast does not establish a doctor patient relationship. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition or treatment. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast. The views expressed are those of the hosts and guests and do not necessarily reflect the official policy or position of any affiliated organizations.
Great job.
Do we even have affiliations?
We will.
I'm affiliated with no one. I'm my own man. So
Yeah.
this is, I imagine us talking about stress will turn into a number of episodes. It's such a massive topic. I hope that we don't immediately turn people off because of just the word stress can induce stress. But I think a good place to start would be with some of the basics. So when I'm trying to describe, Vahid always discusses his pillars of health, which I really like. So when I'm trying to describe stress's role in our daily life and function and how that would incorporate itself into physical therapy treatment, I usually start with sympathetic versus parasympathetic. So most of us know sympathetic is our fight or flight mode. Parasympathetic is our rest and digest. Is that how you've seen it in your textbooks?
Yes,
Yeah.
absolutely.
So, sympathetic neural state, fight or flight mode, we are not meant to be in that state for long periods of time, right? That changes some physiology quite a bit. So I like to think of that as pressing on the gas pedal, right? Revving the engine, getting things ready to fight or run away or be super intensely focused on something. But it's designed for short-term survival, essentially. So it kind of mobilizes our energy substrates. It increases heart rate, increases blood pressure, increases muscle tension, kind of sharpens focus so we can focus on the threat, right? Those are all vital changes to allow us to move, essentially, move faster, move quicker, process things at a higher speed. So chronic stress generally keeps our foot on the gas pedal, right? We don't want to be in that state all the time. It's very helpful to get into that state, and we can talk about that later, right? There are absolutely times when we want to be in a sympathetic state, but we want to easily be able to return back to the parasympathetic state, right? So in my world, the things that this may affect, it's definitely creating, a chronic sympathetic neural state definitely increases muscle tension, muscle tone, like the firmness, the tightness of muscles. Trigger points, which we can discuss at some other time. And then the big one is potentially altered movement patterns because the neural system, the muscle system is just really tense. It's not our normal state of moving. So that's usually where I start when I'm trying to break down stress. And again, I try to get my patients to understand that this is something they should pay attention to. I believe a lot in if patients and clients understand things better, the fear of it will be reduced. So that's how I kickstart this conversation. It's a big conversation to have. A lot of people aren't super comfortable to have it, but I'd be super curious to hear about how you approach this with your clients.
Yeah. Gosh, I'm always reminded of how excited I am to be working with you from these different angles because we're doing such similar work in our everyday lives. It's just we're sort of coming at it from different angles. So, being a trauma therapist, I am, operating in the realm of the sympathetic, parasympathetic at all times. Of late, there's been a lot of good material, good research in the field where clinicians really talk about when we're working with somebody from the psychological aspect of stress. We're no longer saying, oh, you should think about it this way, or I mean, we are, or you should do things differently, or calm down. It's really what we're saying is, let's do some x-ray vision on your nervous system first.
Hmm.
um, if you're having this reaction or this response where now you are having a panic attack, or you feel really overwhelmed, or you're having a flight of thoughts just kind of coming at you, you can't really focus or concentrate anymore, your heart rate's going up, you're getting angry, even you're having a high, you're quick to react. We're no longer saying that it's you're doing something wrong, quote. We're saying, let's look at how your nervous system is responding to this threat. And so I really appreciate removing the pathologizing language and almost becoming partners with our clients, patients, to see you're going into sympathetic often. Why is that? How does that occur? What's going on in your environment, whether it's the day to day living things, or have you started to live more chronically in the sympathetic? And is that due to some trauma in your past, that either the trauma was long term, like we've been talking about a little bit over time, complex PTSD type stuff, childhood trauma, and then that kind of becomes the way of being in the world. And then that creates the issue of what I like that you would bring in is muscle tension, how you move, the aches and pains, chronic pain from last time, even autoimmune issues that could come along because the body has been tightening in this very specific way. So, not to get too deep into it because we can talk forever, but my first the first way we sort of talk about stress is to say, what's the pattern of your nervous system? And to just sort of add the another layer to it is, we talk about what a psychiatrist back in 1999 um, coined the window of tolerance. So that's the parasympathetic or the ventral vagal. Not sure if that's brought in your world, but we talk about the vagus nerve, polyvagal theory. The ventral vagal is where basically parasympathetic is. And that's considered you're within the window of tolerance. Like right now, excuse me, either I'm generally in my window of tolerance, I feel kind of relaxed, engaging with you, can kind of make eye contact via Zoom or Zencast or wherever we are,
Mm.
um, doing our thing. But I could also very easily leave my window. I might start to get, you know, my language might become a little choppy, my heart rate goes up, I'm not making eye contact anymore, I start to become anxious, fight or flight is in, right? And so I'm no longer going to be all that effective in my conversation with you, my communication. I probably wouldn't really connect much. I won't have access to creativity. And so when we're doing work with our clients, it's really important that we help them get back into their window of tolerance, optimal zone of arousal, it's called, because it's really only from there that therapy can be effective. So if they're too overwhelmed or outside their window, we kind of have lost them. We got to bring them back in. We also, in our world, talk about dorsal vagal, or where a person can leave their window of tolerance by going into shutdown or dissociation. I'm not sure if that comes up in your work very much, but there's a sort of talk about the muscle tone. That's really when people go limp,
Hmm.
or they are dissociated, disconnected. Um, it
That's
can,
kind of, I'm not terribly familiar with those terms. I'm probably heard them at some point, but would that be kind of more like upper motor neuron, lower motor neuron type of thinking, or not really?
Maybe you're getting a little fancy for me.
No, I think you're getting fancy. The vagus nerve.
I know. I just need to throw that out there, Adam. With you got a lot of info in your back pocket. I'm not sure. What I do know is when you think about, if you ever heard of dissociation.
Yeah.
Dissociative identity disorder is an extreme form of dissociation. We all dissociate. So, but in the trauma world, we talk a lot about dissociation because dissociation is actually really fascinating. It is a survival response.
Hmm.
So it's a protective response. It's the kind of, if we're thinking about it in the, fight or flight, when it comes to the tiger chasing us kind of concept, this is when we play dead.
Hmm.
We're not playing. It's actually literally the body goes flat. It shuts down. Everything really super slows down. So go from sympathetic, where everything's high up. Parasympathetic is like, all right, normal, everyday digestion, sleep, eat, connect, relate, talk. This is, now I'm flatlined. But it's actually a way to protect the system until the threat is gone.
What it was like? Are you? Do you know the kind of neurophysiology, I guess, behind that? Like, is the purpose of something like that to change our processing so we don't store this experience in our memory?
Sometimes, yes, because if it's too overwhelming, and we don't want to necessarily have to relive it again and again and again, because then we would stay in stress, right? So the body just beautifully created a way to completely remove us from the stressor, the threat, and basically, again, make it all go flatlined, make it all go away. The problem with both of the sympathetic and the dorsal vagal or the dissociative response is when they become chronic, right? In the acute category, they're great. Like, yes, please kick in, because either I need to run, or if I don't have anywhere to run to, then I need to kind of go limp, play dead until the threat is gone. But what happens is, if people live chronically in those things, maybe because of chronic trauma from childhood or some other thing, then that's where you get the issues.
So
Yeah.
let me ask you this. This is super interesting, and let's take a moment, a brief moment, to shout out our bodies for how freaking amazing they are. That's pretty wild.
Yeah.
But if you're working with somebody, what would you say? I know the answer is always it depends, but generally, what would you say your first step is to resolve something like this? I would think the first step would be helping the person better quantify or understand the triggers, or like have some sort of mechanism, whether it's sensory, internally or externally, that they can identify their current state.
Mhm.
Would you say that's like step one? Like, first identify like what's happening when you're triggered into this state, or even the external experience? What would you say?
Yeah, I mean, ideally, yes. And sometimes, and that's really what we're working toward. The capacity to observe and name is really a powerful tool in psychotherapy. It's not just a tool, it's also part of the healing mechanism, right? So if I can observe my experience and name it, then I'm more likely to be able to do something different with it. One of the issues is, again, the exquisiteness of the human body is that with dissociation, it's a removal of awareness. So sometimes it's like people don't know what they don't know,
Hmm.
and they can't name what they don't know. So it's very gentle, very nuanced. I mean, this is a whole part of the field that I'm actually really new in, um, which which is to be able to give words to when a person has left their window of tolerance. And so in our work, sometimes it's a matter of being able to, if a client can't catch it, the therapist can catch it. Um, and then we do different types of interventions to help people come back into their window. We use grounding tools, like seeing, smelling, tasting, touching, hearing, whatever that might be. It might be the tone of the sound of my voice that will help them come ground. Sometimes people have to hold a piece of ice because that has like quite a sensory, um, uh, it can be kind of severe in its communication between the hand and the brain. So it
Yeah.
can really wake a person up. Something that's kind of interesting is smelling salts for
Mhm.
folks who experience, I think, seizures, right? So that helps a person come back to and grounds them in their body very quickly. We don't use smelling salts for dissociation, but I always like the idea of what a smelling salt is meant to do is to kind of shock you back into your body.
Yeah, that's pretty wild. I know of smelling salts from powerlifting to try to, upregulate the nervous system.
Ah, interesting. How does
Yeah.
that work?
I'm not entirely sure of the exact mechanism, to be totally honest with you. I think it's like it's basically ammonia, as I understand it.
Yeah,
But all I know is it kind of jacks up your central nervous system. So in theory, you have more motor units firing, right? The
yeah.
nerves that are connected to the muscle cells. But I want to bring it back really quick and just make sure that remember, we refer to this as the autonomic nervous system, as in these processes a lot of the time happen automatically. So my question to you would be, how much control do you think we can actually have over these things, whether it's
Hmm.
the vagus nerve, or if you have strategies for that, or kind of shifting a state from sympathetic to parasympathetic? Because I think we do have some level of control, but I'd be curious to hear your thoughts on that.
I love the way you name that. And I think this is why we want to kind of have a conversation with our clients about depathologizing this process, is that this is just the natural process. It's built in for survival, right? So it is pretty automatic. And there are some things we can initiate to um, then which then results in the shifting from sympathetic to parasympathetic. It just also so happens there is that mechanism, maybe we can call it like a little bit of a break in the system that kind of brings you back into parasympathetic. For example, I remember one of the very first things I learned about, if you want to counteract the stress response, when you think about sympathetic, how do people breathe? How doesn't any animal breathe when they're in sympathetic? That's a question to you.
How does any animal breathe? Like the musculature or the neurologic component of it? Well,
Um,
part of that is vagus nerve, isn't it? And then it's just shallow breathing. Looking at tidal volume is more diaphragm. Once you start getting into the outer limits of your total lung volume, you have to bring in accessory muscles, and that kind of lifts the shoulder.
yes, yes. But what you said, the key word there is shallow breathing for all of us lay people, right? So that means that I'm going to be breathing really like from kind of chest up if I'm lucky. But
Hmm.
basically right here. And then yes, lots of tension probably, and not enough oxygen going to the rest of the body because there's not enough oxygen going in.
Hmm.
So to counteract that is to take deeper breaths, right? And so it's really strange, but if we have the capacity or the awareness in that moment that I'm taking shallow breaths, which means I'm continuing to stay in sympathetic, and if I'm able to shift to taking some deeper breaths, at first people might feel a little dizzy and kind of overwhelmed, but because there's an influx of oxygen going into their system. But as they do, guess what? They're going to find their way to go back to parasympathetic. So it's not like, hey, Adam, stop being so in your sympathetic, move into parasympathetic right now. I need to have a conversation with you. It's like that doesn't do anything, right? The whole relax thing is awful. Like, don't tell anyone to relax when they're not relaxed, because that's just gonna piss them off even more. I don't know. But
Yeah.
at the very least, if they can initiate longer deep breaths, maybe
Yeah.
that'll.
So like diaphragmatic breathing, I assume is kind of was some of the things that you're mentioning here, or
Yes.
belly breath. If for people who don't know what the diaphragm is, but it's the way I would instruct something like this is lay on your back with your knees bent up, take a deep breath in and kind of breathe through your stomach and into your pelvic floor.
Mhm.
So again, the diaphragm, kind of a horizontal muscle here. As it contracts down, it's pulling the lung tissue down, and it's basically creating negative pressure to draw air in. But to your point, I appreciate that you brought up oxygenation, because I wonder if it's purely an increase in oxygenation, or it's like vagal nerve stimulation, or what exactly it is, or a combination of everything. But there's so many arguments in my field about what exactly is going on with that, or if it's just distracting the patient from um, experiencing their active stress, right? It's okay. Now you're focused on breathing, you're doing something else.
Sure. And maybe that is, working with the vagal vagus nerves, right? So there's a kind of a cool concept called vagal toning. I think you would appreciate this, right? So when you're lifting, you are toning your muscles, or you're strengthening your muscles, or so, and you're then you may be in maintenance mode and X, Y, and Z. So with vagal toning, the idea is that we have to bring exercises into our daily experience to help us go back into our window of tolerance. And the other thing we're trying to do, especially for people who live in chronic stress or have experienced chronic trauma, their window of tolerance might be very narrow.
Hmm.
So you know, stress will make them respond more quickly. They're quicker to react. They get more overwhelmed. They don't have the capacity to be creative, to solve problems. So the window is narrow. The more they do vagal toning, like doing their PT exercises, the more they're going to be able to expand this window. And life doesn't feel so overwhelming. So, yes to that, right? It could be breathing, but there
Yeah.
are other very specific exercises that we like to bring in to help people to start to feel that expansion of their window of tolerance.
Would you ever purposefully put a client into a very acute or high stimulus scenario for them to work on some of those techniques, almost like flexing a muscle?
Sure. I think in the past, as a novice therapist, I might have. Um, but now, what I am more aware of is like kind of safety first. And um, it's like, I'm trying to compare this to some, gym class I took just to relate kind of back to you. But form is very, very important before you implement like lifting, right? So
Yeah.
like practicing in my classes, my gym classes, like we would do, warm-ups or good mornings with the kettlebell, and we'd start maybe with a lower weight, and then we'd go higher and higher and higher, so that by the time I'm doing a deadlift, I know exactly how to move my shoulders, I know exactly how to bend my knees, so there's no injury. But if on day one you said go in there and lift, this 50-pound kettlebell, well, I'm going to probably injure myself. I hope that helped. But there's a similar.
Yeah. That's how I break things down for patients with what I do is phases, right? Like phase
Yeah,
one, let's just try to activate some of these stabilizing muscles, right? Build the mind
right.
muscle connection. Phase two, to your point, okay, now hypertrophy phase, let's put some load through them and get growth. Phase three, now let's get into more functional or athletic activities where you're using those muscles at speed.
Yeah.
So I
Mhm.
imagine that translates a good bit to what you do,
Yes.
just in terms of prepping them for the maybe, I don't know, we'll call it intensity of exercise. Um, but I don't know, maybe I'm completely wrong
No,
in
no,
that.
you're absolutely right. And that's a really important thing for our listeners to hear for both of us is that this might be where I might lose somebody, like in going, I'm going to have you do something. I'm going to expose you to the stressor, right? So
Mhm.
when we're reprocessing a trauma memory, we're actually exposing them to the very thing that traumatized them in the first place. But if I am not sophisticated about it, and I start to do that exposure work, and this person it has one, a narrow window of tolerance, and two, they're out, they're gone, I've lost them, I have a risk of re traumatizing them, injuring them, overwhelming them, stressing them out. Why the heck would they ever come back to me?
Yeah.
Right? So it's a little bit at a time. We want to make sure we're activating the stabilizing muscles first. So are they stable?
Yeah.
Are they able to tolerate, um, more and more stress? And not so much that, but are they able to go back to their window more regularly? Are they able to ground? Are they able to breathe? Are they able to notice and name that they are safe in this environment as opposed to feeling like they have been taken back to the trauma memory? This is called dual attention, meaning I'm here in this present moment while I'm recalling my memory. Some of this is repeat from things we've talked about.
Yeah, no, well, it's really good to revisit these things because a lot of these concepts come into play in all sorts of different things we do. But would you say that there is some sort of time frame for making the changes or adaptations? I'll give you an example. What I mean by that is when I'm working with someone, and let's say there's a muscle that's weak and we need to get it stronger. It's really important to encourage the patient to have an active role in this.
Yes.
I want them to be educated on this so they have a better framework of what's happening. So physical muscle adaptations at minimum take 6 to 8 weeks to occur. We get stronger before that, but that's all like the neurologic side of thing, right? The brain and the nerves connecting to the motor units in an improved manner. So I feel like it's probably a little more easy for me to quantify a time range for the things I do than it is for you. What would you say to that?
I mean, I think you're right, but I also love knowing that it takes 6 to 8 weeks for physical muscle adaptation. I love knowing that. I don't think I've known that. And I really believe there's so much overlap between the mechanism of action in your world and the mechanisms in my world. So who knows? Maybe if I were to start studying and working with a client and seeing, hey, why don't I probably shouldn't expect them to be, jump into full health in the matter of 3 or 4 weeks. Let's see what those 6 to 8 weeks of, like you said, practice, right? Constant practice. I do ask them to attempt to use these exercises outside of session. It's really important that they ground themselves, but I like to the idea of thinking, give it some time, give it some 6 to 8 weeks before you start to implement the next thing.
Yeah, because I always bring it back to the physical tissue adaptations, and a lot of what you're talking about is neurologic or neurochemical adaptations or synaptic adaptations. So that is a thing that we know with pretty good confidence can happen with a certain dosage of stimulus, right?
Yes.
When to your point, doing the exercises this many times a day for this long for this many weeks should, based on what we know about the physical sciences, create this sort of adaptation. I don't know. I just find it really, really helpful to set the framework for patients, especially in a timeline, so they know, these things aren't going to happen quickly. If they do, awesome, but we need to be aware of active participation and timelines for this sort of stuff.
Absolutely.
Yeah. I love talking about sympathetic versus parasympathetic. We could talk about that all day. I think it'd be interesting to jump into cortisol a bit. One of the main, everybody knows that hormone, or has at least heard it. But some of the things that cortisol does in my field, I'd be curious to see if you have any sort of interaction with that in your field. So for when we are in a lot of stress, we're releasing cortisol all the time. Cortisol, if you look at it from, we would call it what is it called? A diurnal hormone, right? We generally see more of it in the mornings versus the evenings. So there is a time point of cortisol release that is based around our normal function. But I like to think of cortisol as the manager, right? It's managing our response to things. It's meant to help us cope and recover in a way. But if the crisis is never ending, that cortisol is staying high. And one of the things it does in my world is it impairs and disrupts tissue healing, especially like inhibiting like collagen synthesis. And then it contributes to like muscle wasting, which we would call the catabolic effect. It can increase fat storage, and it certainly suppresses the immune system. So it's just more impactful of hugely impactful of our entire recovery from an injury or surgery. So again, this is kind of bringing this all back around to, okay, you might be seeing me for, let's say, a herniated disc. That is a tissue injury. There's a lot around that. We need to be aware of timelines. How long should this take, or may this take to change? What needs to happen to create that change? And what are these surrounding factors that can provide the best environment for change? So that's why I'm so excited to talk to you two, because I feel like a lot of the times I max out my role in this, right? The exercise, mobility, functional adaptations, whatever. But creating a good environment is really where I wish I had more tools in my toolbox.
When you say an environment, you mean the environment within the body, or like truly around the person?
Both, because the external environment can very significantly influence the internal environment just from a external stress or load management. Going back to the pillars that Fahid likes to utilize,
Yeah, yeah.
right? Social interactions, reducing toxic substances. That's kind of what I mean. The soup that is our physiology, right?
Yes, exactly. Exactly. Well, something I was finding interesting as you were reading this, and I was just kind of thinking about my own clients, and this would be really interesting to collaborate around, is that chronic release of cortisol. If if I were to, um, I'm just going to do this. Um, if I were to pick up and list off the symptoms of depression for you right now, I want you to see if this, um, let's see, depression symptoms. Okay, just going to see if I can find a few. Of course, some of them are kind of obvious, in the realm of psychology, but I kind of want you to think about it. Maybe I'm wrong here. Maybe I'm just out in nowhere. But imagine if a person was being chronically exposed to the cortisol in their system, in their body.
Mhm.
And you said that it really kind of comes up in the morning. Um, there's disruptions in tissue healing, muscle wasting, increased fat storage, suppressed immune system. Now, check this out. So, depression. feelings of sadness, tearfulness, emptiness, or hopelessness, angry outbursts, irritability, frustration, even over small matters, loss of interest in pleasure in all or most activities, hobbies, sports, sleep disturbances, insomnia, sleeping too much, tired, lack of energy, small tasks take extra effort, reduced appetite and weight loss, or increased cravings and weight gain, anxiety, agitation, restlessness, slowed thinking, speaking, body movements, feelings of worthlessness, guilt, fixating on past failures, self blame, trouble thinking, concentrating, making decisions, remembering things, frequent or recurrent thoughts of death, suicidal thoughts, unexplained physical problems such as back pain or headaches.
Yeah.
Are you with me on the
Yeah.
overlap?
What's that?
Are you with me on the overlap?
Yo, yeah, yeah. That's I probably couldn't speak too much to like the neurochemistry behind it, but that's all related, right?
Right.
Disrupting the neurotransmitters, right? The dopamine, the serotonin, the norepinephrine. Um, I think that's how do we what is there an easy way to measure cortisol that you know of?
I'm sure by now there is some kind of wearable product. No?
I don't know. Let's ask Chad. Let's ask our boy Chad. Non-invasive. Oh, yeah, it's the salivary cortisol. So you spit into a tube. That I imagine that's how a lot of these maybe day-to-day studies are done.
Yeah.
But it would be cool to be able to track that over time and even make some sort of template as to how you experience things and the cortisol release within them and how that can change your experience and processing of those events.
Exactly. And the other thing is that like it almost cortisol begets more cortisol, right? It's like
Yeah.
depression begets more depression.
Yeah.
It's the it's the hallmark of depression when I think
Yeah, I think the point that you were making, correct me if I'm wrong, is some the one of the underlying causes of something like anxiety and depression is stress.
yes. And then so what does that do? Person becomes more depressed. The more depressed they become,
Yeah.
they have these thoughts of I'm a failure, I'm not good enough. Now I can't concentrate at work. I'm not able, I'm gaining weight. I'm not able to eat the way I used to. I don't have energy. I don't feel like working. And it just keeps building on itself.
Yep. Snowball,
Snowball.
the snowball of poor wellness. Yeah. And everybody, if you ask 10 people on the street, is stress good or bad? They would probably say bad, right? I imagine most people would say bad. People are aware that, yes, we should control our stress, just like we should eat a healthy diet, right? But I think there's a huge lack of understanding of what does that even mean? How should we approach the problem of stress?
Yes.
It's not that we can't tolerate stress. Everything has a balance. Exercise has a balance. We too much exercise can be very, very detrimental to the system. So I like some of the strategies that you discussed about trying to identify things that may cause. We were discussing sympathetic, parasympathetic, but it's all related, right?
Yes.
Higher levels of cortisol. Because I believe cortisol is some of the helpful things that cortisol does. I believe it can be the first step in healing, right? The first step in the inflammatory response or the immune response. We just don't want it to continue
Right.
that cascade of release.
That's right.
We don't want it hanging around too much. It's like what's that dessert? It's kind of like a creamy yogurt that they fire the top creme brulee.
Creme brulee. Uh-huh.
Yep, you,
Oh yeah.
you get the analogy. Oh my goodness! Look at this beautiful
I
man.
did.
Just when we thought we had tapped out our
He,
stress talk.
he came in right at creme brulee. I am
Yeah,
so
come on,
proud.
man.
What are you stressing about today?
We're stressing about
I'm
creme brulee, buddy.
I'm sorry I missed today's episode. I thought I'd come in and mess with you both. It wouldn't be a Friday if I didn't.
Okay, so hang on. Let me start over. This
Okay, yes,
information
please.
provided in this podcast is for education. No.
All right. I just
Yeah,
wanted to say hi.
we've
Yeah.
been talking stress, brother. It's been a good chat. Good to see you. Where are you?
Yeah,
As you were. I'm at home now. Finally, it's been a long day.
You live in
Uh,
the woods.
I live in the woods. Yes,
I
no,
see
that's
a lot of greenery.
speaking of
yeah.
managing
I'm
stress,
outside in the backyard.
Well, actually, this would be. I'd love to hear your thoughts. I'm going to put you right on the spot. So
Let's do it.
we've discussed sympathetic, parasympathetic, our autonomic nervous system, and then we started talking about cortisol.
Mhm.
So I know very little about kind of the biochemistry of cortisol, just kind of
Okay.
generally what it might do to our system. But could you speak on that a little bit, and then maybe
Sure.
Pega can speak some more to ways we can uh, get all that icky cortisol out of our body.
but I want to get back to the creme brulee at some point, but we'll wait. We can wait.
I already
Let's
forgot
hear. I want to hear the creme brulee.
the creme brulee. We'll get back. Okay, now quickly, my you guys know that I'm really bad at analogies. Have we established this yet? Okay, well
Well,
we're
I
establishing
know.
it now. Very poor with the analogies. My cortisol creme brulee analogy is a little bit of that fire on top is good. It makes it tasty. It
Right.
completes the dish. Can
That's
we?
right. And then if you do too much, you burn
Yeah.
the whole thing, then you don't have anything left.
Yep.
I love it because that actually works perfectly with what I was going to say. Is
Crushed it.
Yeah, you did crush it. Actually, that's a good analogy. That with everything, I was just speaking to a patient about this yesterday, actually, about how it's all about the dose of the things, right? So there are certain things that if we get the dose right, it's beneficial for us. If we get it wrong, it could be completely detrimental. And I feel like you can apply that to so much in life, but definitely with our health. So overall, I would say key things, if I had to say about cortisol, is that it kind of gets a bad rap, right? We hear cortisol in the media and we think, oh, that's the bad hormone. I mean, if we didn't need it, the body it wouldn't make it. So there's a in your circadian rhythm. There's a bit of a dance that goes on between cortisol and melatonin, right? So cortisol sort of like is your wake up and get at it hormone, and melatonin is like, hey, cortisol, time for you to go to bed, and I'm gonna take over now. So um, the problems arise, and when I say problems, I mean any kind of health conditions and things like that, when we have elevated cortisol for longer periods of time than physiologically we should have been, right? Or then would have been useful for a process that's going on that requires the cortisol. Um, and that's usually when we have chronic stress. I'm assuming at some point today you guys probably defined the different types of stress. Like stress that's ongoing tends to keep the cortisol levels elevated. You can imagine you're going down to sleep and the cortisol is not going down as it should, and it's kind of staying high. All of that's going to wreak havoc. But cortisol in and of itself is actually essential. Like if we didn't have cortisol, we would be in big trouble. Blood pressure would drop and all kinds of stuff. So that's my sort of quick and dirty on cortisol, is that it's the chronic low level sort of stress
What would
and
your
inflammation.
approach to treating chronic high cortisol be? Let's assume that you have exhausted all of the other external factors, right? Nutrition and diet looks good, sleep is good, but what if there's a, let's say, pathologic level of cortisol? Is there some sort of pharmacology that you would implement to drive
Well,
that down?
we're entering sort of um, pretty complex endocrinology type of question here. So it'll be outside of my expertise. Like if we're dealing with actual problems with cortisol, probably it's one of these pathways, like the alpha 17 pathway that leads to it. I mean, there's so many pathways there that I have to go back to my medical textbooks and dig them up and prepare better for a talk like today. But yeah, we could have issues at the genetic level or just in our biology where we are producing either not enough or too much that are real problems, and those typically cases like that, I would always have an endocrinologist involved because it can be complex. But yeah, there's medications that will sort of tamp down some of these things. I could do a bit of research and talk on this next time, kind of like a quick 2 minutes. Hey, Ari, last question, because honestly, I'm not prepared for that, and I don't want to give you some BS answer here and say I need to sound smart. No, I don't remember any of those pathways right now.
That is
But
very responsible of you.
it
I want,
is, it
I
is.
want
It's
everyone.
Friday afternoon. You're asking a lot of me, man.
I
It's
want
been a
yeah.
stressful
Can
day.
you?
I
Why
just
can't you tell me the endocrinological pathways of cortisol? God.
I was just thinking to myself, I even struggle with remembering study names. Like, I will start referencing a study if I'm talking to someone and I'm thinking, I don't remember the study name. I know they did this thing and that thing. And so I'm horrible at remembering these kind of details if I don't. So I use cheat sheets all the time. There you go. Everybody knows it now. But I prepare very well for every single encounter.
Okay.
So don't worry, you're in good hands. I promise.
I am also bad with names. I feel like that's just an excuse that I use a lot to not feel as bad for remembering names. But okay, I really appreciate this conversation, and I think I'm imagining that we will have more episodes on stress. It's such a interesting topic. But I want to take it to it's my turn as I am the episode lead. Woo! And this is probably going to be the number one rated episode. I mean,
Of
if it is,
course.
you guys can't hate me for my skills. Did someone get caught in your throat there, Becca? Did you have some? But it's question time. It's fun question time. Are you guys ready for your fun question of the
I
day?
am ready.
I don't
Okay.
already have my fun question.
How would you prescribe? Yeah. Okay. If you could prescribe, this is a serious question. If you could prescribe anything to your patients, anything in the world, we're talking tacos, puppies, vacations, some sort of medication, lifestyle change, insurance wasn't an issue, what would that be? Go. Either one of you.
What's the goal? That's
Nope.
it.
Nope. No more. No, I'm not quantifying or qualifying the question anymore.
Okay. Okay.
The first thing that comes to your mind. We're talking best thing for all goals for every single patient. Go.
I'll go.
hmm
I'll
Do
go.
it. Do it.
Oh my gosh, y'all are gonna hate me. The listeners are gonna hate me, but I'm gonna say less time online, more time in nature.
You mean other than listening to Take Three and Call Me in the Morning
Yes.
podcast? That's
Put
your
it in your
daily.
ear and go outside. Listen to it and go walk, breathe the fresh air, be outside, connect, feet on the ground, feel your feet on the ground, look at the leaves of the trees, breathe in the fresh air. I would say that all the way.
The
Well,
stimulus of
I,
nature.
I'm literally
We're gonna
doing
package
that
that in
right now.
pill form.
I'm not wearing shoes.
Yeah, yeah, yeah. Vahid is really living
I
this.
am living your prescription.
But can't we just package nature into a pill and take it?
God, here we go again.
That's a great answer. I still don't have an answer. So Vahid, go.
A lot of things are going through my mind, so I'm trying to overthink it. But I would say knowing yourself would be a wonderful place to start for anything.
Oh, that is
Reflection.
Yeah.
so nice.
Yeah.
What would you say? Like being more reflective?
Not necessarily. Because that, like, I mean, it's quite a journey, right? I mean, we're all kind of trying to figure that out. But if I could prescribe it and magically that, all my patients could have it, I feel like everything will be easier once you know and accept and love yourself.
Maybe I was trying to force myself on you because I was gonna say, yep, you guys heard that right.
Yeah.
We are soulmates.
I'm glad this
I
is a remote episode.
I was gonna say forced reflection.
Okay.
Oh,
So I think we have some similar. Actually, honestly, I think all three of ours are kind of along the same lines.
yeah,
Like let's step back and think about things.
that's right. I think the here we go again was not to you, Adam, just to say For me, it was we're trying to commodify and like turn things into buyable products so much that we lose what's already free, right? The
Yeah.
freeness of just getting to know oneself and being with oneself and connecting with nature, or connecting with each other, and really slowing things down, getting off you know the social media, the screens. I hope that we're on our way back to each other. I know that was really beautiful, wasn't
That
It
was
was
beautiful.
fantastic. It was creme brulee.
it? Yes.
Creme brulee. It was perfectly toasted creme brulee. Well, awesome. You guys are the best. Love y'all. Are we
Yeah.
gonna do a teaser for next episode?
Do we have a teaser for next episode?
Nope, we sure
I'm all
don't.
about not having any answers today. I'm
Yeah,
so
the
unprepared. Got the
teaser
camera
is,
vertical. I'm just
yeah,
made a
you are.
mess of your episode here. Sorry, guys.
I hope we get some hate mail on
Sorry, not sorry.
for the
That was my
vertical.
intention was to disrupt this episode. Actually, I looked at my watch. I'm like, I think I still have time to disrupt this episode.
We
So,
are undisruptible, I think, is the takeaway there.
That's right.
all right.
All right, well, teaser for next episode is there will be a next episode, and it's gonna be dope, y'all.
Yeah.
All
Sounds
right,
good.
say bye, Vahid. Say bye, Pega.
Bye,
Bye, Vahid. Bye, Pega.